Well, hello. I'm Dr. Stephen Smith, and I am here in Bishopville. And the reason why I am here is because this is the middle of Lee County. And for those of you who do not know, Lee County has been one of the most hardest hit areas with the coronavirus. Now, this office is right on the main highway. You can hear the traffic in the background. But what we're going to do today is we are going to see how a rural office handles being in the middle of one of the hottest spots in the state with the pandemic. Now, in order to help us do that, I also have here Mr. George General. He's been the administrator of this building for several years. George, I was wanting to know, what would be some things you do even outside of your office?
Here we got two operations, actually we got three operations going on here. Here we got our pharmacy drive-through where the patient don't have to get out of their car and go into the pharmacy to get their prescription. Here we have our community drive-up testing. That way any patient that don't want to come into the clinic for testing, we can do a drive-through here, and also we do the community drive-through. Far corner over here we have our telehealth building for those patients that are afraid to come into the clinic for healthcare services. What we do, we take do a telecommunication, we get all the labs done, and then the provider calls the patient back and they'll do a telehealth communication.
Okay, well, let's go inside and let's see what's going on in here. Okay, who are you?
I'm Ariana Robinson, medical assistant.
Very nice to meet you.
Nice to meet you too.
Now, as a patient, what would happen if I walked in here to seek medical care? What are some of the things you would do to make sure that everybody's safe?
Well, first I will ask if you have a mask, which I see you do, so I don't have to give you that.
That's right. I think you will not find anyone in this building without a mask on.
Yep, and then I will check your temperature to make sure that's good, and then I will ask you questions. Have you had any fever, cough, or what's going on there? Do you have an appointment? If you don't have a scheduled appointment, then I will ask you what's the reason you need to be seen for, and we'll see who we can get you to see.
Well, you're sitting here right up front, seeing people right when they come out of the parking lot.
Yes, sir.
You nervous about being here, or are you nervous about working this?
No, sir, not really.
Okay, well, fantastic. I noticed you have some of the chairs down in the waiting room.
That's so we can try to keep 6 feet distance from everyone as far as the patients if they're coming in, if they need to have a seat. So we have it set up for social distancing.
Okay, fantastic. Well, now I'm going to introduce you to Dr. Sohner, and he is the MD at this office. And we're going to go ahead and ask him a couple of questions. Dr. Sohner, thank you for taking a break and joining us. Well, George was telling us some of the stuff that you all were doing outside, some of the drive-through testing and other aspects of it. What are some of the things you've done inside the building to make the patients feel safe?
Well, we worked on initially separating the sick patients from the healthier patients that we still needed to take care of. And so with this building being the size that it is, we were able to separate the building into quarters and separate sick patients from the well patients that we were continuing to deliver chronic medical care to.
Okay. And did you do anything with the pediatrics?
Yes, pediatric had a separate entrance in the back hallway, and they were able to set up an isolated area where the pediatric patients didn't mix with the adult patients.
And I understand you even have a drive-through for the pharmacy.
The pharmacy situation ended up being pretty good. We were able to close down the pharmacy lobby and use that as an entrance for the adult patients, and the pharmacy shifted to doing drive-through service only, which worked out very well in this particular location.
Well, let me change tacks a little bit. We've been talking about the safety of the patients. How about the staff? Do you get a sense that the staff feels nervous working here?
I don't think so. My observations have been that everybody's really paying very close attention to the social distancing, the use of the face masks in the building, the improved efforts at hand washing on a regular basis, kind of doing everything we can to cut down transmission, not only to the patients, but also to the staff themselves. And everybody seems to be ready and willing to pitch in to help take care of the patients.
Now, I happen to have some statistics in all of CareSouth, not just this office, but all of our offices. We have about 400 full-time employees who work in the sites. Now, we have more than that in total in the corporation. I'll talk about those that work in the medical sites. And we've been going through this for a little over 2 months now. And so far, of those 400 employees, we've had absolutely zero that we know of that have gotten sick from working at a CareSouth site.
Mm-hmm.
Now, we've had some that's gotten sick because some of their family members got sick, some who've gotten sick because some of their friends got sick, but none who've gotten sick from working here at CareSouth, which is hard to beat zero in a situation like this.
Right. Mm-hmm.
Now I'm going to throw you a curveball, and I'm going to ask you a question that you did not know I was going to ask you. But early on in this, when it became clear that Lee County was going to be a hotspot, I came to your office and I pointed out that you may not be the youngest doctor that we have on staff, and that it might be that you have some medical issues of your own. And I offered for you just to go home, that you did not have to be here, and that your job would be perfectly safe.
Mm-hmm.
Do you remember what you said to me?
Yes. I told you that I had no concerns in that regard, that I felt that if I were to come down with COVID-19, it would be a viral illness that I would weather, and my job is here, and my commitment is to the patients here. So I felt no second guessing or qualms about being here for this time.
And you also mentioned that you didn't want to send the patients the message that you weren't there for them.
Right. I think that what patients have looked for from us is stability and reassurance that we're going to get through this thing, and we've been able to do that.
Okay, fantastic. Thank you for taking your time. I know you're busy.
Thank you.
Well, this is Dr. Smith talking again, and one of the reasons I wanted to do this is because I felt like the employees here at our Lee County site really deserved credit for the great work that they've done. But also I had another reason. We are more than 6 feet away. George, would you mind taking off your mask for a second? Now I'm throwing George a curveball because he doesn't know what's about to happen here. But I know that there will come a day, probably in the future, maybe 1 year from now, 2 years from now, 3 years from now, who knows when I may get a message that George has decided to retire. George has been a great service to his nation from his years in the military. He has been a tremendous service to this community for his many years in Bishopville. He has been a great asset to CareSouth Carolina as a company. He's been a benefit to me personally as Chief Medical Officer because I never have to worry about the Bishopville office because I know that they have the leadership here of George General. And in addition, he's been a good friend. And so I wanted to dedicate this video to George General. And we can end now.
Thank you, Dr. Smith. It's been a pleasure. I've always believed in service before self. And after I left the military, the United States Air Force, after 24 years of service, I worked for a cardiology group for about 5 years. And when I was introduced to CareSouth, I knew it was my calling. It was in line with what I had done since I was at age 17, service before self, serving my community.
Okay, thank you.